The Center for Diabetes and Endocrine Research was established with the mission to foster the interdepartmental communication and research of the translational nature on diabetes and diabetic complications. We are a relatively small college where the communication between the basic researchers and clinical researchers is very close. We have a teaching hospital on the campus, so all of this is really very well posed for fostering translational research.
Our research teams at CeDER have a really unique approach, and that is to take diabetes as the model and then use cutting-edge approaches to explore different complications like complications in bone and in fertility and other areas to really advance science.
My research is focusing on diabetic complications in skeletal system. Specifically, I'm working on protein which is essential for insulin sensitization with the name of PPAR gamma, and the same protein plays a very important role in the maintenance of skeletal system. My research showed that targeting this protein with new class of anti-diabetic drugs may not only decrease glucose levels, but is also beneficial for bone.
At the end of the day, I'm a surgeon. I want to have a patient better outcome. I want my patient to be happy. So I want to work with our academic professor in research to have a solution for this difficult problem.
The researchers can do the things we can't. I'm a technician, I can fix things, I can do surgery. They are developing the drugs and affecting the pathways for healing so that the bone cells work, the osteoblasts work, that fat's not being made instead of bone. So we have to work hand in hand on these projects.
My laboratory uses a combination of molecular, cellular, and genetic approaches to understand how obesity and prediabetes affect fertility. We know that insulin is essential for carbohydrate metabolism, but it's also a critical signal to the body that there's sufficient energy reserves for reproduction. And when insulin production or insulin sensitivity falls, fertility suffers.
There is so much that right now is unknown in terms of complications from diabetes as it relates to urologic and fertility. The research we are doing here, especially with cytoskeleton and role of centrioles in sperm function, how diabetes can cause problems with fertility because of epigenetic changes is phenomenal. That'll be next frontier that we need to overcome.
We are developing a therapy is the first of its kind where patients on blood immune cells will be engineered to cure type 1 diabetes. Our laboratory focuses on harnessing the regulatory immune cells, and that cells will reset the immune imbalance in the pancreatic microenvironment and stop the destructions of the beta cells. This will be the one-shot therapy, one-shot living drug therapy, and it will change the life of type 1 diabetic patients. They will start living like a normal human being without having any multiple insulin injections.
It's really a great pleasure to see how our scientists are addressing important, significant problems using innovative, cutting-edge approaches to advance science and advance the care of people. CeDER really is a terrific example of living out our mission, which is to improve the health of our communities and our region by training expert clinicians and scientists and doing nationally recognized research to improve the health of the people in our communities and regions. So I think CeDER and our mission statement are really hand in hand.
I envision that in the future there will be better recognition and care for skeletal complications in diabetes. The motto of our currently funded research is that it is possible to develop one pill therapy which will treat diabetes and skeletal complications simultaneously.
I think everybody hopes that we find ways to manage it better. Not even just the bone, the healing, just the loss of sensation, the amputations, the just terrible complications that these people have throughout their lives. I think everybody wants to see those disappear.
My hope is that in the future, patients with diabetes will not have to deal with complications that affect their ability to have healthy families and affect their long-term health. Preventing and treating complications associated with diabetes is essential for maintaining quality of life for patients with diabetes. Here, we bring together laboratories interested in all aspects of complications, which is really unique in the country.